Welcome to KSAU Master Talk. We are so excited to launch our second season with our distinguished guest, Dr. Yuan So Park, Professor and Head of Medical Education at the University of Illinois College of Medicine. Dr. Park is an international leader in data science, artificial intelligence, and medical education. His work has been transformative and shaped how we train physicians of tomorrow. Today, we will explore this idea further with Dr. Park. Dr. Park, welcome to KSAU Master Talk.
Thank you so much for the invitation. It's a great honor to be here to speak with you, Dr. Nadine, and to also speak and engage with the KSAU community. I'm very excited.
The pleasure is Dr. Park. You are head of medical education. How does your department bridging undergraduate and postgraduate learning?
So our department is quite unique. We're the oldest and largest department of its kind in the world. It was founded in the 1950s by George Miller, one of the most eminent people in medical education. And throughout the years, our department has transformed some of its function, our role, and our mission. And I'll begin with explaining the mission of the department. I'll address your question about the role in undergraduate and also in postgraduate and graduate training. So the mission of the department, we are looking to advance the knowledge and theory of health professions education, and also to train the next generation of physicians and health professionals. So what that means is we study the way how we teach and how we educate trainees throughout the continuum, whether they're in the undergraduate phase, whether they're in the postgraduate residency and fellowship, and also beyond. We also train our trainees in graduate programs. We have a variety of programs in medical education. We have a program in patient safety and quality. We also have a program in implementation science. And the department is a independent basic science department, just like the Department of Anatomy, Department of Biochemistry. But the members of our department contribute to the curriculum of the ND program. We contribute to postgraduate training. And then we also uniquely hold our own graduate programs in a way quite similar to how it's structured in KSAU. So we're heavily involved in all the way through in undergraduate and graduate education, but in a unique way, in a very vast portfolio of different academic programs.
So, Dr. Park, what helps keep teaching, assessment, residency, preparation all aligned together?
So I like the word you use, alignment. And I think that's a key part of education.
So sometimes they use them as a separate KPIs, but they're not.
Exactly. So they're very much aligned. We have a curriculum, and the curriculum has its, very nuanced complexities in a way that the curriculum is like a real estate. It's very complex. There are many different parts. It's hard to move things around. But within the curriculum, you have learning objectives, you have instructional approaches, you have assessments. All of them are aligned in a way that is aligned towards the learning goals. At our institution, it may be unique to our institution, but I think it's shared across many institutions. It's the notion that assessment drives learning. And that term, assessment drives learning, was actually coined by my predecessor, George Miller, who was the founder of the department. And so while, you have the curriculum and while you have learning, we believe that in a way, it's really the assessment that helps drive learning. We don't want the assessment to always have summative and high-stakes consequences. Assessment could be with formative and could have, moderate stakes associated, but it's really the assessment that drives learning. And that's really the key, at least in our institution, that we've helped to move things forward. I'll say one other thing. So the other aspect to education that has really transformed many of the experiences is around the use of AI and data science. And I know that
was going to be my next question. So go ahead. Yeah, you have done a groundbreaking research and work in AI, in the use of AI in medical education. So that was going to be my next question. Since you started, go ahead.
Thank you. So So AI and data science is actually a game changer for us in education.
Yes. Reshaping everything.
Yes, it's reshaping everything. It's reshaping, healthcare. It's reshaping many of our lives, but also specifically in education. The reason is because we know for decades that the key factor to learning and improvement in learning is really based on two things. One is active learning, and the other is feedback. And it's really hard to do both at the same time. You see, if you focus on feedback that's actionable, diagnostic, individualized feedback, sometimes we have to compensate for active learning because active learning happens in a group environment. And then if you concentrate on active learning, then you have to also compensate for feedback. But AI allows you to do both at the same time. So this has been a puzzle that we have not been able to solve for decades. But now with AI, actually you can provide individualized feedback with AI. And then the faculty and the teachers can focus on active learning and vice versa. So AI has really transformed how we educate our learners and then also how learners perceive information. So that's one critical area. But also in terms of the broad array of curriculum and alignment, we can also use AI to see how student progression is aligned directly with learning and with outcomes. So it's really been an immensely transformative aspect for our work in education and more broadly. We have also used AI to do two other things. So one is, our physicians and health professionals in the next generation will need to know some of the competencies of AI, the basic knowledge of AI, but also what's good AI, what's bad AI, what's socially responsible AI, how to use AI to care for patients. By the time our students graduate, our trainees graduate and serve the public, 25, maybe 10 years later, the technology that's used today will be completely different. It will be even more advanced. So it's really important for us to train our current students and our trainees. What are some of the ingredients and competencies for to become an AI-enabled physician or an AI-enabled health professional? So that's one area that we have really leveraged AI in our work. The other is to go back to the aspect of contributing to learning and assessment. How do we develop AI tools that can really help bridge this active learning with feedback? So those are two areas that I think are really important and key for the next generation.
Will you be able to give easier, personalized feedback?
Absolutely. I think we have evidence. So I'm not just saying this because we have a hunch or we have anecdotal evidence. We actually have empirical evidence through many studies that are showing that students that receive feedback, AI-based feedback, of course, it needs to be trained. It needs to be trained with a good model. Once students practice with these AI-based feedback, they actually do much better than the traditional.
Are you guys doing this in your department right now?
And these types of studies, we will see more of into the future.
I believe so. I believe so. So there's another national study you have done focusing the transition between undergraduate medical education to graduate medical education. What are the key lessons from these studies?
So actually, one of the motivations that we started looking at this undergraduate to graduate transition actually started from a different angle, but we've kind of gone into this transition. So the way we've actually wanted to look at this was, if you have innovations in your medical school, if you have innovations in your program, it's very hard to evaluate those outcomes. So for example, in my medical school, let's say we create something new, innovative. I mean, the most we can do is maybe one of two things. We can survey, the students, were they satisfied? We can survey the residency program directors. Exactly. And surveys, have response rate issues and so forth. The other thing also is maybe we can look at, the licensing exam performance, maybe like your MBBS exam, final exam that you have. But those, almost everybody passes. So it's hard to evaluate what happens. What we've done is we have linked medical school performance with residency outcomes, and we've begun to make that link in a way that is used to evaluate medical school success in the curriculum. In doing that work, because we were trying to solve how we evaluate medical school curriculum and innovation, we found that that tool to link medical school to graduate residency actually helps the transition. Because there's right now, what happens in medical school happens in medical school. What happens in residency happens in residency. There's no connection. In many places, that's how it is. But once we are able to link the UME to GME, there's a continuum for the learners, because for the learners, they're actually going from one phase to another. And so that continuum, we're able to study using that mechanism. And the mechanism, again, goes back to AI, because we're dealing with a lot of massive data, and to understand what sources of information, whether it's objective data, faculty ratings, licensing exam scores, which of these sources of information actually make a difference when they go into residency. AI is able to synthesize that information, give that information to the students, to the faculty, so that they can prepare. So for example, if I'm a student, let's say a third-year student, if I want to go into surgery, and if my performance is X, Y, Z, and so on and so forth, with the data, I can be able to predict with a level of certainty what I need to work on. These are the things I need to work on if I want to go into surgery. These are the things I need to work on if I want to be successful in my first year residency. So that's how it's going into the future.
This is fascinating. Did you build this AI module in-house specifically for your students, or was it adaptable from different area?
So both. We actually first started for just our school. And we've expanded this to create a consortium of 15 institutions within the United States. And across the 15 schools, we're now sharing the platform. It's almost like an AI coach. This AI coach, we are creating a centralized data hub. And across the 15 institutions, we are sharing this algorithm and this tool so that students can be successful when they match and go into and transition into residency.
Have you studied that after the student use it? Did you see the result?
So we only have at the moment some pilot results.
I'm excited to see the final result of this. It sounds really amazing.
Yes. And this is actually something that we call precision education.
Yeah.
I know maybe the term precision medicine has been used in many different places. This is precision education in a sense that you're providing precise, individualized, personalized information back to a learner, depending on where they are and how they're progressing. And this model of precision education is something that in the United States, at least, there's a lot of studies, a lot of empirical studies that are undergoing as well.
Dr. Bارk, I'm so excited about this. I would really stay looking for this study, how it's going to unfold, and see how the result will be. It sounds really amazing in a unique way in education. If we do always see a lesson to appraise residency readiness, how you define that?
So, each specialty within the profession defines, what are the minimum criteria that's needed to enter residency. The United States, we have a set of criteria. I'm sure here also in Saudi, with the regulatory organizations, you have your specific requirements. So that's the readiness requirement at the national level. And then at the program level, each program has their own unique aspect. So if you're going into psychiatry and you're going to the University of Illinois psychiatry program, it has its own specific requirements for readiness. But then also each resident has their own individualized readiness factor, because maybe with a little bit of feedback, the resident might be slightly behind, but then they can easily pick up, right? So that's, those are things with remediation. They can be ready and they can be prepared. However, there might be things where they're completely not ready and they may not ever be ready. And so how do we understand, or how do we detect, or how do we identify those gaps earlier on, so that maybe they can pivot and look to a different specialty, or they can, with the right guidance, be immensely successful. And it's just that initial barrier that you need to go to. So it's a combination of the different levels, the national requirement, the program requirement, you as an individual, and then how the system helps the individual push that barrier to become ready. We've seen, with empirical data, residents who we thought might struggle, but with the right kind of remediation, with the right kind of training, they've surpassed expectations. But also at the same time, we've seen residents at the beginning of training who are, just flying, and then the second year, somehow they're falling behind. And so again, I don't want to say this again, but with AI, we're able to detect the developmental pathway of where the learners are going. So if they're progressing on the right way, but then if they fall behind, the AI is able to pick, that inflection point and identify the immediate point where they need to pick up and get better. So the readiness is not just at the beginning of training. It's not just at the end of training, but it's throughout the training and how they develop. And we're looking at that developmental pathway because everybody develops and improves in a very individual manner.
I'm so impressed with the AI model. So I'm going to ask again.
Yes.
Would this AI model will be adaptable for other institutions, or it has to be in a certain population, need to be adjusted? Or another way, if we do a collaboration and we test data from different country on that AI model, would it work? Or what else we can do to make sure this is not unified only for one area?
This is an excellent question. So how can we, what's the portability of these types of approaches to different settings, different countries, different regions? So I believe we have portability. At the same time, we need to have, good, robust, sound data, because the AI needs to be trained. The AI needs to understand, how the individuals are progressing. Probably, there are common things as trainees that are seeing wherever you are. But also, because the curriculum is different, because maybe there could be cultural aspects, the competencies are different. There are probably things that needs to be customized to a local setting. So to answer your question, I believe, yes, we have portability of the approaches, but also there's an opportunity to refine so that it's even more customized to the local setting. And that's what we're finding even in the United States. Among the 15 institutions, they're spread across many different states in the United States. So each school and the requirements, we're having to adjust to the variations of the institutions.
So we talked a lot about AI. Whenever we talk about AI, people will ask, what about the ethic principle? How are you going to guide us? What's the guidance in this? What the regulation? What is the policy? People get worried when you say AI and data.
Absolutely. And I think this is an area that we know it's important, but there has to be more work. There has to be much more thought process into the ethics of AI for education, ethics of AI for learning. Let me give you an example. So a lot of the AI, it's about prediction. It's about, using the data to make assumptions so that, learners will use those probabilities to change their learning behaviors. However, just because we have data, it doesn't mean that we can just predict and have these models. So, we have social norms to consider. We have the specific qualities of assessments to consider, the consequences of individuals, because these are information that a learner who's earlier in their stage going to use to continuously improve. So all of these aspects, I believe, are very essential. Even the research aspects of AI, I think, needs much more work. At the moment, many of the journals for AI, the requirement is only to disclose whether they used AI or not. There really isn't much more in-depth thinking around the ethics of AI, the rigor of AI, whether the AI that it used changes interpretation, for example. So we don't have a good answer for this at the moment, but I hope that many colleagues in the field and the communities, as we begin to implement, are giving considerable thought into the use of AI so that we have some harmonized standards and expectations of how AI will be used. At the same time, our students are using AI already.
And they're not hesitate to using it.
They're not hesitating. And so
That's good. Yep.
I think we have to move quickly, I think, to
Some people, when they enter their data, they are more hesitated to share their stuff. So I'm glad they do it, but we might find this in different environment that where people not sure if they should I enter my data or my stuff in AI. How can we encourage them to trust it more?
Yes. So the entrustability of AI is a very multifaceted.
Especially in education.
Yes.
It has their own information.
Yes. So it's a very multifaceted domain. I think users, stakeholders of AI have to trust it. So let me give you an example. If I give feedback to a learner that's AI based, and if the recipient is not trusting the validity of the AI, they may or may not make sense of it. Whereas you may have others who may trust in it and use it. And so if you can imagine a variation of trust levels that vary. But I think that's where the co-production model needs to be in place. So educators will develop new AI tools, and we will need to inform the stakeholders that this is going to be transformative, this is going to help the learners. The learners will need to trust with some degree. Of course, they always have to be cautious that this will lead to improvements in their learning. And that co-production model, I think that's where we need a little bit more of integration into the future. Right now, we're not so sure how well this is integrated at the moment.
Clear. You have written about rethinking what counts as evidence in medical education. How should we redefine evidence as the technology continue shaping or driving the innovation?
Yes. That's a very tricky question. How do we define evidence? Because let me start with the background, and I'll answer your question.
Sure.
So in specific disciplines, let's say in basic science and otherwise, there's a tradition of how evidence is accepted. For example, a positivist approach. You build a hypothesis and you test the hypothesis, and you find an answer. So that's how you trust your evidence. In medical and health professions education, we have people from so many different disciplines: basic scientists, clinicians, we have people from humanities, psychology, and so forth, that have multiple different traditions that the terminology of evidence become, and the methodology of how you gather evidence and how you interpret evidence become very complex. And I say this because sometimes the general audience may not understand the discipline of medical and health professions education. So it's a very diverse group of researchers, academics, and professionals. So in this area, how do we define evidence? How do we know what's good evidence, what's poor evidence?
Yes.
So we do have standards for how we determine this, but it's a process that needs some kind of a consensus. So consensus, you might argue, is an understanding between
Two parties.
Yes, two parties, multiple parties, and so forth. Sometimes the consensus even becomes an alignment because maybe we don't get to consensus, but we can live with an alignment. So the spectrum of evidence in medical and health professions education becomes quite varied. But that's how we've used evidence to get to where we are. We've made significant progress, and we know that we're making progress, but because we're getting better and better, even with this dynamic and very broad discipline that we have.
Amazing. Before I end up, for our listener, for the medical education faculty and students, what's your suggestion? What's your recommendation for them?
Yes. So before I conclude, I just want to appreciate and really thank KSAU for inviting me
It's our pleasure.
for speaking in this forum. I think, you know, education traditionally, whether it's medical or health professions education, a lot of our work has been, you improve education and we have better education. Improve education, we have better education. But where we are going is better education leads to better health outcomes. You invest in education and you get better trained physicians and health professionals will deliver better healthcare, will ultimately have better patients and better public health for the system. So it's a whole linking of that system. And I say this because we are at this time with the continuum of data and AI that we can really show and demonstrate the value of education. If you invest in education, if you train better, competent, and trustable physicians and health professionals, they will do a good job on caring for patients and the clinical workforce that will lead to better outcomes. And I think that whole continuum, which hasn't been possible in the past, is really enabled by the technology, with the data, with the electronic health records, with how we study the science of education. So I encourage my colleagues in the community to also contribute to this continuum of a better education to better health outcomes in our work. Thank you very much.
Thank you, Dr. Park, for sharing your insights and your experience. It's been fascinating conversation, full of information. I personally enjoyed it, and it was very useful. Thank you very much for making it here in KSAU Master Talk, and later on in the seminar. And to our listener, thank you for joining us in KSAU Master Talk. Stay tuned this season. We will continue reshaping the future of health sciences. Thank you all.